Vitamin B12 is an essential nutrient that is necessary for DNA synthesis, energy production, and central nervous system function. Even though the vitamin is found in many foods, vitamin B12 insufficiency and deficiency are relatively common. This is often due to limited dietary intake, malabsorption, certain medical conditions, or the use of B12 depleting medications. Now, as the ability to absorb B12 from food declines with age, deficiency is more common in older adults. However, it is also common in pregnancy and can be seen in young adults and children. In this video, we are going to discuss about the most common presenting signs and symptoms of vitamin B12 deficiency. Vitamin B12 deficiency can cause weakness, tiredness, or lightheadedness. Our body's cells need B12 to function properly. Deficiency in B12 or folate can cause megaloblastic anemia. This condition leads to the formation of large, abnormal, and immature red blood cells and impaired DNA synthesis. When our body doesn't have enough healthy red blood cells to carry oxygen to tissues, we are likely to feel weak and tired. But remember, these generalized symptoms can be seen due to many other reasons. Vitamin B12 deficiency can cause red, painful, and inflamed tongue. This condition is called Hunter's glossitis or Moller's glossitis. This can be an early sign of vitamin B12 deficiency. On oral examination, you can find stomatitis, xerostomia or dry mouth, chillosis, and bleeding from gum. Remember, glossitis can also be caused by deficiencies in other nutrients like folate, riboflavin, and niacin. Paresthesia in hands and feet. Paresthesia is a medical term that refers to a burning or pins and needle sensation in certain areas of the body like hands and feet. Many adults and kids who have B12 deficiency report experiencing paresthesia. Now, unfortunately, this symptom of B12 deficiency overlaps with symptoms related to diabetic neuropathy, in which there is nerve damage caused by high blood sugar that can cause pain and numbness in the extremities. People with diabetes taking metformin are at higher risk of developing B12 deficiency because this medication can reduce vitamin B12 absorption in the body. So, a B12 deficiency could be misdiagnosed as peripheral neuropathy in people with diabetes. As a result, many experts recommend that people taking metformin regularly should get screened for vitamin B12 deficiency. Vitamin B12 deficiency is also associated with the risk of developing depression. Vitamin B12 is a necessary element for our central nervous system development. Now, having a low levels of vitamin B12 can cause elevated levels of sulfur-containing amino acid called homocysteine. High levels of homocysteine increases the oxidative stress, which is responsible for DNA damage and cell death in the body. Low or deficient B12 levels may lead to other medical conditions including psychosis and mood disorders. Difficulty concentrating and mental impairment. Vitamin B12 deficiency can cause concentration problem and it is more common in older people. But the good news is vitamin B12 related mental issues is treatable with adequate amount of vitamin B12 supplements. Gastrointestinal problems. A B12 deficiency may also cause diarrhea, nausea, constipation, bloating, gas, and other gastrointestinal symptoms. These issues can affect both adults and children. Vitamin B12 deficiency is responsible for frequent headache. In fact, headaches are among the most common reported symptoms related to B12 deficiency in both adults and kids. According to few studies, people with high vitamin B12 levels are 80% less likely to have migraines. Muscle cramps and muscle weakness. B12 deficiency negatively impacts motor and sensory nerve function, which can cause muscle cramps and weakness. Impaired coordination. Ataxia or impaired balance and coordination is a neurological symptom that can be caused by B12 deficiency. As such, a person with B12 deficiency may have difficulty walking and balancing. Next is erectile dysfunction. Men with B12 deficiency may experience erectile dysfunction as a result of increased levels of homocysteine in the body. Vision disturbances. B12 deficiency may cause vision disturbances, possibly due to damage to the optic nerve. Alright, that's all for today. Hope you liked our video. Don't forget to like, share and subscribe to our channel. Thank you.